I want to switch gears just a little bit, and I'm wondering if you can tell us about the symptoms of leptomeningeal disease. Some patients may be concerned that they're experiencing something that might be indicative of lepto, but
Yeah.
maybe they're similar to brain metastasis. So maybe you can comment on that.
Yeah, they are similar, but there are a few distinctions that we like to keep in mind. So, similar to brain mets, you can get kind of focal neurologic symptoms, your quote unquote sort of stroke-like symptoms, right? Where you're thinking speech and motor deficits and so forth, depending on the location of the mets. But lepto is similar, but a little bit different. So when you go back to that original question of where is leptomeningeal disease, that'll help guide us to what the symptoms are. So if you're talking about the fluid that surrounds the brain and the spinal cord, what lives in that fluid are various nerves that control functions around your face and head. So those are called the cranial nerves. And then through your spine, coming out of your spine are spinal nerves that float in that fluid, that live in that fluid. So they can be impacted by cancer cells in that space. So you see a lot of what we call cranial nerve symptoms. So that's things like numbness on your face, on your chin, difficulty chewing, swallowing, facial weakness, double vision. So and hearing changes. So a lot of things dealing with your cranial nerves, because those nerves are affected because they're in that space. And then spinal nerves. So that can control things like neuropathic pain. So numbness, tingling, pain that you can get from spinal nerves. And then your lower down spinal nerves that control really critical functions with your bowel and bladder. So you can see some changes there as well. Additionally, because it's the fluid that this is living in, sometimes with these patients, we can get a fluid buildup. So we get this pressure, if you think of it, pressure increase. And with that, we can see things like headaches, nausea, and vomiting. So there are a variety of symptoms that leptomeningeal disease can bring upon, but those are kind of the basics 101 of symptomatology.
I love that visual that you provided, because I think I always just kept thinking of it in the brain, but we have to remember that lepto really affects the brain and the spinal cord, and it's that fluid. So I really like the way that you described the cranial nerves are going to have some different symptoms versus if the lepto is around your spinal cord. Because
Right.
I've worked with lepto patients who have trouble walking. So I thought that was the main symptom, but it really does seem to kind of run the gamut. So thank you for that explanation.